That's the 1 2 1 2. This is Dr. Mark Boykin, and we present this presentation on diabetes mellitus, a chronic degenerative disorder. This presentation will discuss the signs and symptoms and treatment of a chronic degenerative disorder called diabetes mellitus. The goals of this lecture is to understand the definition of diabetes, to learn the damage done to organs, to know the symptoms and what to look for, and to examine preventative options as well as to look at treatment plans. This is a slide of diabetic retinopathy. This is what happens to the retina during long-term diabetes and the damage that it does. The term diabetes means literally sweet urine, and it's characterized by the 3 P's: polyphagia, polydipsia, polyuria. Also increased thirst, hunger, and urine output. The term end organ disease is usually applied to chronic degenerative disease such as diabetes. The end organ disease because it's the final destination of the chronic process, and it can have effect on every major organ in the body. All organs are affected, mostly the eyes, kidney, heart, nerves, liver, brain, and pancreas. Two types of diabetes that are most common: type 1 and type 2. People with type 2 often do not have any symptoms. When symptoms do occur, they are often ignored. Symptoms in type 1 usually come on much more subtly and are often severe. Symptoms include excessive thirst, increased urination, weight loss or gain, fatigue, nausea, blurred vision in women, vaginal infections in men and women, yeast infections, dry mouth, slow healing sores, and itching in the groin area. Prevention: get more physical activity, strength training or lifting weights, eat plenty of fiber, maintain a healthy weight, low glycemic diet, and combining food groups. Diagnosis: diabetes is diagnosed by non-fasting glucose of over 200 or fasting glucose of 125. Prediabetes is 110 to 125 or HbA1c of over 6.5. Treatment is lifestyle modification, weight reduction, a drug called metformin which also helps to reduce the weight, insulin if they're insulin dependent, and statins because of the risk of high cholesterol as well. And here we have a picture of the organs that are affected: the kidney, the liver, the brain, the pancreas. Ultimately, most every organ is affected in diabetes mellitus. And this was brought to you by Dr. Mark Boykin. If there are any questions or anyone needs to contact me, you can visit me at www.drmarkndnow.com, and I'll answer any question on diabetes. This is a Mark Boykin production. This is a Mark Boykin production.